Dr. Elom Hilary, currently an assistant professor of medicine at the University of Missouri, Columbia. This is my first ASH conference that I'm attending. I'm at a point of transitioning my career right now to hematology and oncology. So I figured that if I want to be a hematologist and oncologist, this is the conference that brings all the experts in the field of hematology. So this was a great opportunity for me to come and hear from the experts in the field. That's kind of like will propel me really into the entire field. That's a very interesting question overall. Being a hospitalist at the University of Missouri, where I see quite a lot of patients, one of the most important things that we have to recognize is that every patient is different. And we have to approach them differently. Uh, Most of the sickle cell disease patients that we see in the hospital are coming with significant crisis, either painful crisis or acute chest syndrome, and we have to be very compassionate about these patients. Sometimes, because they are in severe pain, people tend to assume that they are just seeking medications, but we have to put ourselves in their position most of the time to realize the burden that these patients are carrying, and most of the time they are really in severe pain, and we have to listen to them, be very compassionate, and try to manage their pain effectively. That also goes with multiple myeloma as well that we see in the hospital. Um, Currently, in my position, we mostly co-manage this patient with the hematologist in our center. And basically start with having the right diagnosis if it is someone that we already don't know that has multiple myeloma. Um, Most of the time, they tend to come in with either some other complications like renal disease or electrolyte imbalance like hypercalcemia, or even pain, low back pain. So once we see some of these features, then we have to do more investigations to be exactly sure what is going on and at what stage they are. And then we can collaborate with some specialists in hematologists and oncologists to address their condition. Myself, I'm a young physician, so I'll be giving myself those advice. I recently completed my residency just last year from the University of Mississippi before moving to Missouri, where I currently serve as an assistant professor and also a hospitalist. Um, what I would advise in terms of a career choice overall for young physicians like myself is to really dig down in their mind and know exactly where they want to spend the rest of their life, the kind of clinical scenarios that they want to be seeing, and what drive, what give them the job satisfactions. Myself, when I finished from residency, I wanted to I was in between being a gastroenterologist and a hematology oncologist, actually. I finally made up my mind this year that I was going to be a hematologist oncologist. So that's why I initially told you that I'm transitioning my career right now. I'll be moving to North Carolina next year, where I'll be starting my fellowship in hematology and oncology. So I tell the young folks here, listen to yourself, listen to what your mind is telling you, and there is nothing you cannot achieve. Just stay focused and go for it. And also to be involved in research. Research is very important, especially in the field of hematology and oncology. Yeah, it's a very highly evolving field, and you have to stay up to date with various clinical trials that is coming out, various protocols that is ongoing, and also to be involved in those clinical trials. Um, that would help you to really take care of your patient wherever you find yourself. So, in this age and time, there are so many avenues where you kind of like get information from. Um, there is various journals now electronically that you could access. And I tell a lot of new generation, it's not like in the olden days where you only have access to physical uh, journals. But now the comfort with your phone and with your tab, with your laptop, you have millions of resources that you could use to access innovating a new clinical trials that is kind of like coming up. Um, there is UpToDate, there is Medscape, there is Doximity AI, quite a lot of them. So personally, what I do is every day that I wake up, I tend to go into one of these resources um, and look at what is coming up and try to read uh, one uh, trials, one upcoming or ongoing clinical trial. And in my campus, in our hospital, if I see any clinical trial that is ongoing, I try to get involved myself, assist the principal investigator or be a sub investigator myself, recruiting patient, talking to, a patient, and kind of like learning on the go in real time what is going on in the field.